Jana Kubisova, and I would like to give you a brief overview of how hearing loss and the use of hearing aid could affect our brain and its plasticity. It is important to know about this topic because many people suffer from hearing loss. Specifically, 30% of people aged between 65 and 85 manifest some degree of hearing loss, and about 70% to 90% of people aged 85 and above experience depressive symptoms and social isolation and results of this hearing loss. Hearing loss is largely untreated because almost two-thirds of older adults with hearing impairment do not seek professional help, which prevents them from getting adequate hearing aids. Helen Amivia and others found in their 25-year-long study that even a slight change in hearing increased the risk of cognitive impairment by 24%. The greater the change in hearing threshold, the greater the risk of cognitive decline. Therefore, hearing loss is associated with an accelerated cognitive decline in older adults, and it negatively impacts their ability to multitask. This is precisely because it takes them much longer to understand information and identify and separate words from background noises. Consequently, people with hearing loss need to pull on many more cognitive resources than other individuals with normal hearing indicators. Hence, what brain processes are related to this cognitive decline? People with hearing loss have less gray matter, especially a temporal lobe that includes primary auditory cortex, which is important for the processing of auditory information. Gray matter is a major component of our central nervous system, and its sustenance is facilitated by cell bodies that help transmit auditory information through the cerebral cortex. Therefore, the lack of information we receive as a result of hearing loss degenerates our gray matter. Gray matter is especially important when processing speech in background noise situations. When the speech signal is compromised, more cognitive processing is required and gray matter volume becomes more important because the lower the volume of gray matter, the worse our ability to differentiate speech from background noises. On this picture, you can see MRI of brain that measures response of the brain chemicals to magnetic field. This picture represents image of normal hearing brain on right side in comparison to one with hearing loss on left side. There is a visible difference in neural activity between these two halves of the brain. Using MRI, Dr. Ling tested if hearing loss is associated with cognitive decline and increased incidence of dementia, as well as reduced volume of gray matter in the auditory cortex. His findings suggest that people with hearing loss have faster degeneration of brain and temporal lobe, as well as lower gray volumes. That underlying causes of these findings remain unknown, but it is believed that they may be related to poor auditory signal. More studies were done for hearing aids use and its effects on brain functioning. My two examples include Taiwan study using EEG and Lewis study examining participants' improvement of understanding in background noise situations. EEG records electrical activity of the brain through the electrodes placed along the scalp. These electrodes detect spontaneous brain activity or activity in response to stimuli, which is in our situations means in response to sound. This study found that deaf people show no signs of brain activity in response to sound. However, if they are exposed to cochlear implants for as little as 3 months, the EEG records activity organized in a way similar to tonotopy described in normal hearing subjects. These findings suggest that auditory plasticity may occur through the lifespan, depending on the amount of available auditory input. Although not that long ago, we thought that neural development occurs solely during childhood and then stopped. The second study, conducted by Levely, found that after 14 weeks of wearing hearing aids, people show improvement in understanding of speech in challenging environments, even when their hearing aids were removed. This suggests that even a relatively short period of amplification's use can induce plastic changes in a central auditory processing system in the brain of older adults. Therefore, anyone aged 65 and above should get their hearing tested on an annual basis to prevent cognitive decline, as untreated hearing loss can have significant impact on a person's life. On a more positive note, we can prevent this deterioration thanks to the plasticity of our brain, which enables our older adults to adjust their hearing abilities with only slight help, such as hearing aids. It seems that if we don't use it, we lose it.